Okay, increasing supination of the left wrist. So we have the dowel. You're going to grip white knuckle with the wrist. We want to be kind to the wrist as you try and rotate your forearm up towards the ceiling, almost like you're holding a cup of soup, if you will. So gradually ramping up and finding where you feel it most in the forearm / elbow rather than in the wrist itself. It's important that if we look from the side, so the wrist needs to remain neutral, not extended or flexed. Okay, so find your end range position where you feel some tension up into the forearm up here.
Okay, that's it right there.
Great. Okay, you have the option to stretch this out for at least 30 seconds or up to a minute. And then what you're going to do is you're going to gradually increase the pressure where you're going to try and rotate. Essentially, in my perception from the video, is going to be in a counterclockwise position or direction. Clockwise for you. Very good.
Yeah, I'm doing that now, and I'm feeling it in the upper forearm muscle.
Perfect. And you want to be deliberate about trying to contract from the forearm rather than at the wrist.
Definitely.
Okay, we talked about how the wrist is like a ball of marbles or a bag of marbles. Right? So it's hard to control those degrees of freedom, but you need to do your very darndest. Great. Now you're going to contract in the opposite direction just as vigorously. So holding steady with the with the right arm, you're going to try and rotate in your perception clockwise or counterclockwise. Yep. But not with the right. The right just stays there, and with the under the volition of the left forearm, you're going to try and rotate up and around.
Okay. It's not going anywhere.
It shouldn't. We care not about the articulation, we care more about the intent. And the fact that it doesn't go anywhere tells us that you've done a very good job of finding what is your end range of motion, which is necessary in order to make the adaptations within the interosseous membrane of said forearm. Great. You do that for 30 seconds, going gradual and incremental, not over time, to ensure that we're not over exceeding the capacity of the wrist, because there's a lot of sensitive structures around there. We also talked about how you could do this with an elbow extended, which would increase the tension because of the additional myofascial tension at the elbow, limiting what would be your supination, and that would be potentially a progression.